Tools for Easing COVID-19 Related Anxiety, Part 1. I want to start with introducing myself. My name is Dr. Samantha Morris. I'm one of the psychologists at Student Health and Wellness, Mental Health. I'm going to be talking to you today about some tools for easing COVID-19 related anxiety. We're going to start in this Part 1, and there will be 3 parts to this series. So hopefully it'll provide some really good information about anxiety and some skills to help cope with it. So what will we be covering? We'll start with what is anxiety. So just kind of defining what it is, talking about the different components of anxiety. So maybe you can try and recognize the signs that you might be seeing in yourself or other people. We're going to move into COVID-19 and mental health. So some of the specifics about what's making this a hard time for a lot of people. And then move into what can help. We're going to start by talking about what is anxiety. So this is really going to set the base for the rest of the video. I wanted to start with a quote that I think really captures anxiety quite well. "These mountains that you are carrying, you were only supposed to climb," by Najwa Zebian. So I think this captures anxiety because we are up against some mountains right now. It's a very hard time for a lot of people around the world. And so it's understandable, that we're all climbing this mountain together. But that doesn't mean that you also have to carry the mountain around with you each moment of every day. So that's sort of what we're going to be talking about in terms of what anxiety can do and how it makes people feel more distress about what's going on. So what is anxiety? Anxiety is the emotional response in anticipation of real or perceived danger. So notice the word anticipation. That's a big part of anxiety. Anxiety doesn't tend to happen to things so much in the present. It's more worry about what might happen or could happen in the future. This is where it differs from fear. Fear is a reaction to danger that's happening in the present right in front of you. Whereas anxiety, again, is more anticipatory feeling. Anxiety is often a misperception or exaggeration of actual threat. So maybe there is something that's there and is a threat to you. However, anxiety tends to make it seem bigger and scarier. This slide has the 3 components of anxiety: thoughts, behaviors, and feelings. And we're going to get more into each of these in a moment. But what this is really meant to depict is that thoughts, behaviors, feelings, they're always interacting with one another. So if someone has an anxious thought, that leads to an anxious behavior and then affects the way that they're feeling. So the take home here is just that these 3 components of anxiety are always interacting with one another. Starting with thoughts. Thoughts is one component of anxiety. There are certain thought patterns that are very common to anxiety. One is worry, so you may be familiar with this one. Worry is thoughts about impending threats that repeat over and over and over again. The purpose of worry is really for people to feel like they're preparing for the possibility of something happening, planning about how they're going to cope with that. However, it often goes beyond this and just becomes cyclical and nothing ever really gets solved. So that's kind of what worry looks like. Catastrophizing is another common thought pattern with anxiety. This is when people think about the worst case scenario. So, we're all at home right now, staying safe. Catastrophizing would say, we're going to be here for years, or we're going to be here and it will never get better. I won't be able to see my friends. I won't be able to get a job. Things are going to be bad. So that's kind of what catastrophizing looks like. All or nothing thinking. So that's just what it sounds like. It's also sometimes called black and white thinking. So either something's all good or all bad. That's often seen with anxiety. Probability overestimation. This is another one we see a lot. Again, just what it sounds like. So, there's a small chance that people, when they're driving, could get into a car accident. Someone who's anxious about that might say, no, anytime I get in my car, I'm in extreme danger. So those are some examples. There's more that we're going to get into in part 2 of this series. So just know there's some anxious patterns that are very common with our thoughts. And one of the main goals in these coping patterns is going to be to try and change the thoughts. Behavior. So there's common behaviors with anxiety as well. Some of these are avoidance, ineffective safety seeking, and unhealthy coping. Avoidance, so when people are anxious about something, they tend to try and avoid it. The rationale is, well, if I don't have to be around this thing that makes me anxious, I will feel better. And in the short term, yeah, that kind of works. The problem becomes that in the long term, people never learn that they could face the thing making them anxious and feel better. So, this is someone who maybe is avoiding doing their online courses because it's new and it's hard and it causes anxiety. So they go on social media or they watch Netflix and they don't do it, and they feel more relaxed. However, then they fall very behind on work, and to start facing that and doing it feels even bigger and bigger, and their anxiety gets worse and worse. Ineffective safety seeking. So this is sort of some of what we're seeing with people trying to gain control through things like buying a lot of supplies, ones that maybe aren't so important to what we actually need right now. So the actual anxiety isn't being addressed. People are trying to feel in control, but maybe get home and don't feel any better. And then unhealthy coping. So this is when people try to make attempts to make themselves feel better, feel less anxious. It actually causes higher anxiety. So this might be someone who is drinking alcohol every night to try to fall asleep and does fall asleep, but they're not getting good quality sleep, and the alcohol makes them feel more anxious the next day. So those are some examples of the behaviors we might see with anxiety. Feelings. Anxious feelings are broken down into physical feelings and emotions. Physical feelings has to do with something called the fight or flight response, which you may have heard of before. It's the body's physiological reaction to stress, danger, threat. The same response comes about when someone is feeling fear or is afraid of something. So it has to do with a lot of different physical symptoms that people might feel from the fight or flight response. We see increased heart rate, increased breathing rate, sometimes hyperventilation, sweating. People sometimes feel nausea or other GI symptoms because the body is shutting down the GI tract to direct more energy towards important things like blood flow, things that someone would need if they were fighting or running. So the physical feelings associated with anxiety all have to do with the fight or flight response. And then the emotions, so here we see things like fear, dread, sadness, a whole range of emotions that can come along with anxiety. So in this next section, we're going to talk about COVID-19 and the way that it might be affecting people's anxiety right now. So the next few slides are really going to cover more about that. Living in a pandemic. So for many of us, I would say most of us, this is a first, right? We're living through a pandemic for the first time in our lifetime, and it's a scary time. There's a lot of things that make feeling fear and anxiety very normal and understandable. So there's the threat. There's the threat of getting sick and people we care about getting sick. There's people dying. Very, very scary. There's also a lot of uncertainty. We don't know when things are going to get back to normal. There's a lot of change. Many of you are doing online classes, living in different places, maybe far from home. And this also leads to isolation. We can't socialize in the same ways we're used to. We can't go out and see people. So all of this is a huge adjustment and really contributes to people feeling more anxiety and fear right now. I wanted to take a moment to talk about how the pandemic might be affecting people who already have anxiety or who even have been dealing with anxiety for a very long time. So in this picture, we see a person skillfully making their way down a mountain on a snowboard. And it's meant to depict, for folks with anxiety, you may have been preparing for something like this for your entire life. And by that, I mean, we talked about how anxiety tends to have these catastrophizing, worst case scenario patterns. Well, this could be someone's worst case scenario. And I think what's really important to remember, if that's something that's true for you, is to let anxiety help you in the ways that it can. So let it prepare you, let it protect you. And it's really important to know when anxiety has gone beyond that. So when anxiety has become troublesome or is causing distress. With that in mind, we're going to spend some time in the next slide talking about what are signs that anxiety's gone from being, helpful in ways that it's protecting us and making us be careful right now to a place where it's just adding to distress. Signs of higher anxiety. So these are ways that you can tell that anxiety has gotten to a point where maybe you need a little more support. So unable to get a thought or worry out of your mind. So this is just these repetitive worry thoughts that keep going and cause distress, and sometimes things like difficulty sleeping. Avoiding work or other commitments, avoiding emotions. So not able to do your work and putting it off, procrastinating, leads to things building up. Avoiding emotions. Sometimes, you feel anxiety but really don't want to feel it, so you're doing things to try to numb yourself or distract yourself and not experience those emotions, which does tend to build up. Engaging in unhealthy coping, so trying to do things to make yourself feel better, but again, you feel worse. I referenced drinking alcohol to fall asleep as an example of that. Another is experiencing frequent physical symptoms. So you notice physical symptoms that haven't been there before, such as headaches, body aches, pain in your chest. Some people experience that. Any kind of GI distress, nausea that's happening daily. These are things to just kind of keep a lookout for. And all of them may be signs that anxiety is kind of persistent and high right now. So the final slide is going to move into what can help. So just a little introduction of what the next 2 parts of this series are going to cover. Coping tools that I'm going to move into that are helpful with anxiety are going to be drawn from something called cognitive behavioral therapy, or CBT. Some of you may have heard of this before. It's a very common form of therapy that's been proven to be very effective in treating anxiety and a whole other range of difficulties that people experience. The focus of CBT is really looking at the way a person thinks, and a big assumption behind it is that we have the power to change our thought patterns. So if there's certain thoughts that are making a person feel more anxious, we want to identify those thoughts and help a person challenge and change them to thoughts that are more helpful. And you would be amazed at the power that thoughts have over the way that we feel. Secondly, we'll be talking about behavior modification. So this is looking at what are your behaviors throughout the day. Some of them may be in response to feeling anxious. And what are some ways of changing behavior that might help you to feel better? So the thought patterns, that's going to be part 2 of the series, and behavioral modification will be part 3. So if you have interest in learning more about these coping skills, please join us for the next parts.